My name is Madeline Brimmer. I'm a pediatric audiologist with Norton Children's ENT and Audiology, and I test hearing from the age of infant to all the way up to 21 years of age and fit hearing aids and cochlear implants on children who have hearing loss. Depending on the age of the child that we see in our clinic, there's several different types of testing that we can do. For example, when we have a newborn who comes in after they have failed a hearing screening at their birth hospital, we typically will do what's called an automated ABR, or automated brainstem response. And for that test, we put some stickers on the forehead, the cheek, and the neck on the baby. The test measures the brainwave response to the sounds that we're playing. So we play some sounds through the earphones that we put on, and we're measuring just how the brain is responding to that sound. Because it is an automated test, that test is a pass-fail test. So if the baby does not pass that test, we have some more testing that we do. It doesn't necessarily mean that the child has a hearing loss. It just means that we need some more information, and we would refer on for a more in-depth test where we're measuring the actual hearing thresholds at different levels and different frequencies to make sure that the baby can hear or see how the baby is hearing. If the child does have a hearing loss, there are many different options that we can pursue. Depending on the type and degree of hearing loss, we have hearing aids, bone-anchored hearing devices, and cochlear implants, all of which we fit in our office, and we work with the families to teach them how to use the device, teach the child how to learn to listen, and hopefully with the end goal of pursuing spoken language. We also have speech-language pathologists in our office that we work very closely with to give your child the best outcomes and the best support to reach whatever desired outcomes you have for your child. I'm originally from Northwest Ohio, but I went to Ohio State University for both my undergraduate and graduate schooling. I came to Louisville originally to finish up my graduate schooling, where I completed my externship in this office with Norton Children's Audiology and ENT. Following my graduation, I decided to stay on and accepted a full-time position here. For fun, I have 2 cats and a dog. I love to take my dog on walks and go on runs with her. I also love to play games and hang out with my friends and family.